Hey folks, Ashley, allthingsdenture.com. I just want to talk about fabricating a job relation record for this patient here, or maxillomandibular relationship record. This is Aaron, and we're going to be fabricating a complete maxillary immediate denture. We'll be extracting these teeth, providing them with a little bit of pre-prosthetic surgery, removing some of this fibrous and osseous tissue in the premaxilla, in an effort to allow us to better place or have better placement of the teeth, his anterior teeth. So we fabricated a final impression prior to fabricating his denture, the immediate denture, and we fabricated provisional mandibular partial denture that we're going to continue to use for the next few months. Aaron will be passed on to another resident to complete well, whatever is going to happen. He may actually have maybe treatment time for some implants on the mandible. In any event, just like complete dentures, we're going to be going down the road of we've captured our final impression. Now we need to capture a maxillomandibular relationship record, and there are a number of ways of doing that. And one way we've been taught is by fabricating a jaw relation record on denture base and wax rim. Now the reason why we're using this is because this is a fairly stable platform. I mean, you can use Blue Moose, you can use whatever product you are happy with, of course, and there are many different ways of doing it. And this is just one way of using a denture base with a bit of wax and some Blue Moose in an effort to be able to mount these in the correct 3D position in centric relation. So you can see right now, and I tried doing that actually with Blue Moose and another material, and it just isn't stable enough. So we fabricated, I'm going to show you the one way to just fabricate these simple denture base jaw relation records, and then we'll have something stable that I can place on the cast, mount the cast together in proper orientation in 3D, and then continue with fabricating the immediate complete maxillary denture. Okay, so now I've Vaseline the entire cast, and what we're going to do is now take our triad or visual light cured denture base material and fabricate our denture base. So we are going to bring it just apical, coronal of the, you can see that soft tissue undercut. So we're just going to bring it to approximately just less than that, so we can be able to place it intraorally and actually be able to take it out without getting it locked. Okay, so I placed the base plate wax material, base plate material, as visible light cured, so just use my 25 blade just to remove any of the excess, and we're going to now put this in the light curing oven. You can see now we haven't just captured a little bit of the alveolar ridge, the crest. Okay, so here now is the record base, the denture base, cured out of the light curing oven. Here to remove it so we don't. There we go. So the Vaseline worked. And now what I'm going to do is just take football burr on a slow speed and just round everything off. And the next stage is to place some wax in strategic spots. So I've added wax rim to, or a piece of wax rim to this denture base. Now, two things I forgot to mention was earlier, I mean, you could conceivably use Blue Moose or some sort of polyvinyl siloxane or any kind of registration material to capture your registration, by all means. That's one way. This is what we find to be a little more stable. However, that comes down to more of an opinion. And the second thing is, once you fabricate a denture base for a specific cast, This will not fit any other cast. So if you're planning on not mounting the cast upon which you fabricate your denture base, you're going to have to fabricate a new one, and I'll show you why. Because I ran into that problem. So I fabricated, and not in this situation, I've now learned. Fabricated the denture base, we saw. Now here's the original diagnostic impression, and you see it just will not fit. It's going to rock. I could, I suppose, grind that in. So that's another food for thought. So what we're going to do is just walk through placement of the wax. It's fairly straightforward. I'm going to light up my torch using regular denture base wax. It's right here. Fold it, and you can get these in prefabricated. We have them, but for this case, you just need a really thin little piece. So I'll run that over the torch. You can see it's melting. Goes together. And I'm sort of just guesstimating how much I'm going to need. We do have, it's actually a cast, that's not really very helpful. We do have tooth-to-tooth contact on his right side and some on his left, so I don't want to put too much wax, but I don't want to put not enough. So what I'm going to do is I'm just going to melt. I mean, I've learned you can place sticky wax on there. I'm just going to melt some base plate wax. And with regards to the instruments, any wax instrument will do. Okay, so what I'm going to do is I'm going to heat up the bottom surface of that. And try not to burn my fingers. And we're not using this as an aesthetic wax try-in or phonetics or anything. It's strictly a job relation record. So this will be the first point of contact, second against the mandibular partial denture, and the third will actually be his tooth-to-tooth contact. And we'll just clean this up now. So now we have our job relation record fabricated and ready to try in. So in the morning I'll be placing this intraorally and just sort of checking the occlusion, and essentially we're trying to capture a CR record, centric relation. Now what we're going to do is then remove the excess wax, because I've built this up, it's easier to remove, and then we're going to make little slots similar to a complete denture, and then use a polyvinyl siloxane or blue mousse material. That's what we use here. I'm sure there's many different products you can use. And then make an undercut in here. Place material onto the rim, and then get the patient to close into CR. And then we'll have our record captured, and we're able to, then we'll check to see if we can reproduce that. Now, one of the problems with when you layer this, I was just doing this, is that when you layer the base plate wax, it's great, it comes off like that, but so does the rest of it. It'll come flying off. So one of the things to prevent that is either use a full block, the prefabricated blocks and not layered, or just heat it up with a wax instrument and remove this, and then sharpen it up so you have an undercut similar to this, in an effort to retain your blue mousse. Cheers.